So a woman walked into the pharmacy, and after a few questions, I discovered it was not what she ate. It was not even the fasting she did like she claimed. Guess what? It was the pain relief she took that gave her stomach ulcer.
Oh, Jesus! You say what?
So in this video, I'm going to walk you through how to understand the link between peptic ulcer and pain relief, especially the NSAID, non-steroidal anti-inflammatory drugs. I know most of you must have heard, if you have ulcer, don't take certain pain relief. Yes, that is true. Or certain pain relief will cause you ulcer. A lot of you must have heard that. And there are few persons that have not heard about that. But relax, I'm going to do justice to it. You understand the link. You understand how the pain relief you are taking is capable of causing peptic ulcer if it's not already doing that. So that you will know about your medication and use it right. That is my duty. I'm a pharmacist. So I will help you to understand your medication and to use it right. So before I will go into the drugs aspect of it, let's understand what happens in the stomach.
Put your ear down. Put your ear down.
Of course, you can agree with me that the concentration of the acid in our stomach can dissolve my glasses. That is how concentrated the acid is, and that is what is in our stomach. So why is it not burning our stomach? God is awesome, because he has built a structure that protects such concentration of acid. One of the substances that contributes to the protection of the stomach from being destroyed by hydrochloric acid is prostaglandin. That is where prostaglandin comes in. So this prostaglandin helps in the stimulation of mucus. It also helps to stimulate the secretion of bicarbonate and mucosal blood flow, and that is what maintains the concentration of such level of acid. So whatever that destroys prostaglandin has exposed the epithelium to this hydrochloric acid, and once that happens, peptic ulcer has set in. So once there is an imbalance between the protective factor and the aggressive factor, ulcer sets in. So how does the pain relief, especially the NSAID, cause stomach ulcer? Now let's dive into it. Now I'm going to list some of the NSAID so you also be aware of them. Not all pain relief is capable of causing stomach ulcer. Something like Ibuprofen belongs to the class of NSAID. Diclofenac, tyrosicam, Aceclofenac, these are NSAIDs. That is how they are being classified. And what do they do? What is their mechanism of action? Now remember I mentioned something, prostaglandin, right? Yes. Now there is an enzyme that produces this prostaglandin that protects your stomach. This pain relief will inhibit that enzyme, and that enzyme is called cyclooxygenase. Now we have cyclooxygenase 1. In short form, we call it COS1. We have cyclooxygenase 2, we call it COS2. So this set of pain relief will inhibit both COS1 and COS2. Remember, I told you COS1 is responsible for the production of this prostaglandin that protects the inner lining of the stomach, while the COS2 is responsible for production of prostaglandin that transmits pain to the brain. So it is this COS2 that produces prostaglandin that causes pain. So once you take them, they will inhibit COS2 and your pain will be reduced. But they are not just inhibiting COS2, they are inhibiting COS1 and COS2. That means even while your pain is being relieved or being reduced, it is destroying your stomach. Having known that, what do you do? And that is why you need to watch the next video for me to explain that. Remember, the mission is to help you to know your medication and to take it right.